WHO's regional office for the Western Pacific. I'm happy to be back in our studio. Well, we have a little studio here today for our third episode of Your Health Today and Tomorrow, a series of conversations designed to help us understand key health issues in our region, drawing on future-oriented perspectives. And we have with us, typically, we have health experts, practitioners, and our very own staff. In the first episode, we discussed how obesity and other risk factors might shape people's health and well-being. In our second webinar, we explored transformative primary health care. And you can actually go back and listen to those discussions. We will pop in the link in the comment section so you can go back and see what we did in the first two episodes. So before we kick off today's conversation on using digital health to ensure everyone has access to healthcare services, let's give the floor to our Regional Director, Dr. Saya Mau Piukala.
Distinguished speakers, colleagues, and viewers from across the Western Pacific region, greetings from Manila, and welcome to our webinar series on the future of health. Since the beginning of my term as Regional Director, I have been reminded of the dynamic and rapidly changing nature of the Western Pacific region. It stands as one of the most diverse regions in terms of population, landmass, and economies, presenting a myriad of health challenges and opportunities both now and in the future. We must anticipate changes and critically assess what might shape the future of health, well-being, and health system in the region. By understanding the possible futures, we can mitigate risk while seizing opportunities to achieve our vision of better health for all. In other words, we can realize our preferred health futures. In the spirit of coming together to contribute ideas, experiences, and skills, in the same way as adding our unique threads to a woven mat, I invite you to join us in imagining the futures we aspire to. So together, let's chat about your health, now and tomorrow. Over a series of discussions, we will explore key aspects of our future and help shape WHO priorities for the Western Pacific region in the years ahead. We'll delve into the drivers of non-communicable diseases, explore the building blocks of climate-ready and responsive health system, discuss pandemic preparedness, and examine the role of health technologies in addressing health inequities. We want everyone from different countries and walks of life to be part of this important conversation. So please, come with us in our journey to improve health and save lives. Let's work towards a future where no one is left behind, worried about what the future holds for their health or the health of the people they love. Your insights, perspectives, and active participation are the strands that will weave the myth of our shared health future. Thank you very much.
Thank you very much. That was our Regional Director, Dr. Saya Mau Piukala. You know, they say if you're working on today's problems, it's too late because the future is here, and we'll talk about the past a little bit, but we will talk about where we think we're going, and I think digital health is a great way to start that conversation today. I'd like to greet everyone who's with us currently and also those who are watching on the playback, and encourage you to stay with us. We have 4 excellent speakers. We only bring you the best speakers on this program, and they're going to share their perspectives and experience using digital health to ensure that everyone can access healthcare services. So first, we are delighted to have Professor Maxine Whitaker, who is the chair of Reaching the Unreached Technical Advisory Group. Welcome, Maxine. Maxine is here for another meeting, and we're so glad that she's able to join us on this webinar. We also have our next speaker, very familiar face in the regional office, Dr. Rajendra Yadav, the coordinator of integrated disease control here in the regional office, who works on integrated approaches to protect and treat populations against communicable disease, and he's well known for his work on tuberculosis. We also have, all the way from Papua New Guinea, Ms. Priya Manava, Technical Officer for Strategic Health Information, joining us online. And Priya has extensive experience in data analysis, supporting countries to strengthen health information systems in the Western Pacific. And last but not least, we have Lei Motilia, who is co-founder and social innovation lead of AI for Gov here in the Philippines, which produces digital innovations to support better public service delivery. So welcome to our speakers and welcome to all the people who are watching us today. Okay, before we, together with the speakers, before we go into the actual webinar, we have some housekeeping tips for you. All right, so if you have any questions, you can use the Q&A function in Zoom. And if you're watching on social media, please post your comments in the comment section. I think I'm going to be able to get that from here. And we'll go into a Q&A session a little later. So if you have questions, write them down, hold on to them, and you'll have a chance to interact with our wonderful speakers for today. So we're going to start with Maxine, Professor Maxine, who wants to be called Maxine only.
Yes, thank you.
And okay, before we start into the into digital health, how did you get into working on digital health, Maxine?
So it's one of those tools that's available for health system strengthening, and I'm involved a lot in community and health system strengthening. So it's something you need to understand if you want to actually help towards universal health care and reaching unreached populations.
So you mentioned community, and I think when we think about digital health, we typically think about big systems, and you talk about community and reaching the unreached.
Yes.
So speak to us a little bit about what you see as the role of digital health in reaching the unreached.
So I think digital health can help if it's designed to reach those populations and with those populations. I think it is an intervention that can be one of the tools for universal health coverage. But we have to realize there's a lot of things that make people unreached. It's not just a physical geographic location that if you put some more towers up or a satellite that can beam digital connectivity down, it's going to meet their needs. It also may be age group, it may be cultural and social values. It may be lack of trust in digital security or even in government systems. It may be people who don't have a house or somewhere to collect it, so people living on the streets. And not all women necessarily in every culture are allowed or have access to a phone for their own use. And so again, they may not be reached by a technology if it doesn't take that into account about how can you secure that technology for them to be able to reach it. It's called digital health inequity, and it's something that we need to consider as we design this to actually reach the promise that digital health could provide to us.
So you talk a little about, you mentioned the word trust, which I think I want to sort of take off from that. And we know that there are generational issues with that too, right? Because young people, of course, are more, what should I say, more open to using digital technology compared to older generations. And that's a huge part of the shift that needs to happen. Would you like to speak to that?
Yeah, part of it's trust in the technology and feeling comfortable and familiar with it. But even some of the younger generation are also worried about who's accessing our data and how they're going to use it. So they may be more digitally savvy in how to use it, but there still may be trust issues. People with mental health issues, young people wanting to talk about sexually transmitted infections, they may not trust that technology for some parts, for the consultation part, maybe yes for some of the data or information, but even then they may be worried who's creating this information for us, because that can be the downside of, say, AI and some of these technologies. It can also create the misinformation and disinformation that we're really concerned about now in health systems.
And we're seeing a lot of that. I think, people may also game the system, right?
Yes.
Same way that young people go online with different identities, different ages, and so on. So, and then you also have the issue of people who are not comfortable with technology at all. So I think we're really looking at a change that's happening because of technology and many different reactions to it, right?
Yep.
Which and we were just talking about the number of languages we have in the world. What was the number we had?
7,000.
We have in the world we
More.
have 7,000 languages, and in the Western Pacific region, it's what?
3,000.
3,000. 3,000 languages, right? So the diversity in itself really creates questions for us.
Yep. Yep.
But in the same way that when radio was introduced or television was introduced or computers were introduced, people said, oh, it's not going to work, it's not going to take off.
Yep.
What we're seeing is this is taking off really
Yep.
quite rapidly. So anyway, so you want to say something, Rav?
Yes, all technologies have their upsides and downsides. I see more upsides as long as we have proper governance and regulations in place. So I agree with Maxine that there are some aspects that we have to worry about, like data security and privacy.
Yeah.
But as long as we have strong governance, international as well as national, I think it has lots of benefits for humans. I read somewhere, the title of the article was, AI will not replace humans. Humans who know AI will replace humans who don't. So we have to jump on the bandwagon and maximize it.
Yeah.
But as Maxine said, we have to take care that the data is protected.
Yeah, you know, one of my friends who was doing many months ago when ChatGPT became very accessible had a very simple statement like this. He said those who use ChatGPT will advance further than those who don't use it. And I think, you know, some of this is also about the community and how it can use AI. So I'm going to ask Lei to speak to that a bit about how important it is to involve the community in developing digital health technology. Go ahead.
So a practice that we do at AI for Gov is building community lexicons. So in this way, we can represent the voices, diverse voices of people in the community and how they express issues related to health, related to their aspirations and needs, so that we can train the AI models to be tuned to these expressions. And in that way, we can bridge divides, even though it's not through a physical infrastructure. Because, for example, the chatbot that the Department of Health uses, so one of the training data there is coming from the BHWs, or barangay health workers. So in that way, they're part of the user designers that is feeding the content in the chatbot.
Okay, so these are new things or new dimensions of digital technology for health. Priya, all the way there in Papua New Guinea, tell us about how digital health is taking off there and your experience in it.
Yeah, so Susie, we were talking about languages before. PNG has over 800 languages,
Wow.
very diverse country.
Yeah.
Both in its population, but also geographically. We've got many hard-to-reach populations, dispersed populations with a mountainous terrain. And so digital health and the disruptions we've seen to date really have huge potential in PNG to be able to reach these people, improve quality of services, improve access to services. An example in PNG is with the National Health Information System, which 10, 15 years ago, health workers were having to fill out paper-based forms, sometimes walk long distances to take it to the provincial office, where then it was entered in computers and sent to the national level, or had to be posted to the national level. And you can imagine the delays that this resulted in to be able to use data. But now we have an electronic national system in all provinces in over 800 health facilities.
Wow.
And that's an incredible achievement. You've now got data in real time available for decision making, and that's really incredible and shows how digital health can really change. And we've seen more disruptions happening globally with telemedicine, being able to reach populations in hard to reach areas with artificial intelligence that's helping with diagnostics, screening, mental health chatbots, etc. So the potential is really great, particularly in settings like PNG. The question, as everyone has already mentioned, is around how we can do this safely and how we can sustain this.
Thank you so much, Priya. I mean, very interesting. A lot of developments in a place like Papua New Guinea, and you were just reminding me when I was studying. Raj, have the same experience, right? We had to write everything down, right? And when you're in the classroom, you have to, follow these plastic transparency slides that, no, this is dating me. But I think what we're trying to say is that this is now part of our history in public health, that there has been a, a leap. A leap in the use of technology for health. And so we are going to talk about what our guests think about this in relation to the future. And so we have a video that's been put together by the Innovation and Research team on how digital technology is transforming many aspects of health. So let's watch it, and we're going to use it as a start-off point to talking about what comes next. Please.
Innovation through digital technologies is transforming our everyday lives and driving us into a new era of healthcare. Digital health means the use of technology to help health systems become more efficient, support health workers, and improve patient care. Fueled by innovation and rapid evolving technologies, digital health is an $86 billion global market today, and it offers great potential to make quality health services closer, easier, and better for all. Here are some examples of impact of digital health. Better linkages. Digital technologies can help to collect dynamic, real-world health data from many sources. It can link devices and places and bring this data together in real time. Interoperable information. Interoperability is the key to connecting different data sources to make medical records accessible to all points of care, or to help public health agencies or health providers detect outbreaks more rapidly. Improved analysis. Artificial intelligence has opened up powerful avenues to improve diagnosis and assist health workers in evidence-based decision-making. Improved access. Healthcare is no longer confined to your doctor's office. Telecommunications and visual technologies are helping bridge gaps and enable health service delivery in hard-to-reach areas to help achieve health for all. New tools. From simple technologies such as e-learning for health training and use of biometrics in disease tracking, to medical robots filling gaps in health workforce, digital technologies offer new tools to help meet the health needs of today and tackle health challenges of tomorrow. Alongside the unprecedented use of digital technologies for health, innovative approaches to their adoption are also needed so that patients, providers, and governments everywhere can benefit fully. The next era of healthcare is beginning. How can we harness digital health to promote and protect the health of all people?
Okay, that's a great segue to thinking about the future. And I guess, when we think about the next 10 years, 20 years, maybe in the year 2040, what do we actually see happening? What might a desirable future be? And what would you worry about if things went wrong? So I'm going to ask Raj, because back in the day, right, and you were working on tuberculosis, we used to do the acid-fast bacilli stain one by one, right, under a microscope. And if you were using an X-ray machine, you had to put on these huge, thick vests and run to the other side while you say, hold your breath, right, and run around. But it has now changed a lot. So what do you see happening in the future in something specific like tuberculosis control?
Already the technology is so advanced that we have ultra portable machines that have low dose radiation, where people don't have to run like that and hide behind a lead plate.
Yes.
But rather, people in Vanuatu and Kiribati, they are carrying around ultra portable X-ray machines on their backpack. And these are powered by AI to triage patients who may have TB and who may not. Those who may have TB, they can use rapid molecular tests on the spot using, again, portable gene expert machines, for example,
Yes.
to diagnose TB. But those who may have TB, then the X-ray may be just transmitted to the nearest radiologist
Yep.
through telecommunications to
Through a
get the
phone.
proper.
Yeah,
Exactly.
through a phone.
And that phone is connected to the ultra portable machines, which,
Right.
as I said, can be carried on a backpack. So things are becoming very interesting. Even in Philippines, for example, they have been using AI-powered X-ray machines to screen 700,000 people in villages and remote areas over the past few years. So it's a huge number. Initially, there was some worry from the radiologists that it may harm their profession. But actually, these AIs are just a tool. They are not here to displace radiologists, but rather they triage patients so that people who can't travel long distances, if they are screened to have no TB, then the process stops there. But if they may have a likelihood of TB, then they are referred.
So 2040, Raj, what do you see?
2040, I believe two big things happening. One is that we humans are already getting to become one human through connectedness. The digital technology, we still have issues of data privacy and security, so people don't trust, like Maxine was saying. But over time, humans will develop that trust and the systems will be put in place so that our data can be shared with full data security all over the world, wherever we stay, wherever we work, wherever we travel. Doctors and the persons themselves will have access to bioinformatics, genomics, and all those nomics to give us precision medicine.
So it's going towards precision medicine, being very, what should I say, very specific in terms of what individuals need and not hit and miss. And definitely, you're talking about speed, right? That things are going to go faster. So I want to ask Maxine, speed, real-time reporting, and all of that. Will this create new inequity?
Yeah, I think it is something we just keep having to keep in the back of our minds.
Okay.
That this is not a panacea. It's a tool to design into a health system to provide universal health coverage.
Yeah.
And in that system, you still need the rest of the health system to work. You need the health workers to be trained in how to use this technology and to use the data for decision making. So the promise is there with digital health to be able to have, as Priya talked about, more data for decision making. But people need to have that skill to do that and to be able to respond. In that video, that Mongolian example that was there, I think that's a nice example of how they've used digital health to do some of the screening, but then they have the mobile teams come out to those unreached populations. Right. So it's improved the cost effectiveness of doing mobile teams by having the digital health there to help do some of that screening and maybe help the health worker out there to make a better decision, because often they've got no supervisor. They can access supervisors by using this. But you still need, for many of those unreached populations, a service to go out there.
Right.
And what you're often not getting, one of the concerns from a community point of view, and particularly from a gendered perspective, is in a face-to-face consultation, often the health worker, be it a doctor or a nurse, a volunteer, looks at other things when the person's sitting in front of you.
Absolutely.
So,
absolutely.
And
Yeah.
often that's a chance, if you think gender-based violence might be a problem, to be able to raise that in a situation, which often in many of these digital consultations or tools are very focused on one or two points of care, what the
Right.
immediate thing is that
Right.
I've come with.
Great.
Don't allow you the opportunity to then follow up with some of those probing questions, maybe with some of the behaviour change communication that you need to do for that person in that point of time. So it's not a panacea, but it does allow the system to have more scope.
Right.
When you've got limited radiologists and limited specialists, it allows it to be more efficiently using that. And I think that's the promise. But it's not going to reach unreached populations unless we put that in the design.
Yeah, so again, faster but not necessarily fairer, right? Not
Correct.
necessarily. Priya, you've got great coverage in Papua New Guinea. Are people using the technology that you have in place? How are they using it? Is it making them, what should I say, make better decisions about health?
Yeah, so I think that's a really good question, Susie, and I'd like to come back to what Maxine has mentioned, that in the end, digital health is a tool towards universal health coverage. The end goal is to ensure that we're seeing improvements in the health system, whether that's access to services, coverage, quality, affordability. And whilst we are seeing new digital health tools being implemented, like I mentioned before, we have over 800 health facilities reporting data in real time. The issue now is, with so much data, are we using the data for better decision making? And as Maxine has pointed out, that's something that will require new set of skills. It requires the necessary policies and governance to be in place, the necessary infrastructure. And so we need that supportive environment to ensure that these digital health technologies are translating into improvements for the health system. And we're getting there step by step in PNG, but there's a lot more to be done in strengthening the broader environment, putting these necessary support systems in place to ensure that we really are seeing improvements for the health system. And you mentioned, what would we like to see in 2040? I think for me, what I'd like to see in a setting like PNG is that these digital health technologies that are being used are translating into measurable improvements for health systems, for communities, and for families.
Thanks, Priya. I'm going to ask Lei this question because we were having this conversation before we started, right? That, there's big pharma. For us, there's big tobacco, right? And there's an economic dimension to the upscaling of digital technology, which could put a lot of power in the hands of some giants that have the money to, what should I say, to design, to actually steer how this technology is going to be used, not how it's going to be used, what is the technology that's available. And when Priya was saying, it's all there, but it's not really being used, I'm thinking, this is like, I'm having PTSD from my college days where they say, stop researching on the community, research with the community. So it's like you have to have the end user with you on day one, so that they will use it. Otherwise, if you developed it and you serve it and say, hey, please go ahead and use this, you find out that they don't want to use it. So I think you're coming from an organization that's trying to address that particular issue, that the development of digital technology is happening in some, laboratory somewhere that's sterile as far as the community is concerned.
Yes. So a question that we always want to ask or ring the bell is, who is developing the technology? Who are the designers, as Maxine has said, and what are their values? Because a public health and digital technology is a socio-technological system, which means that there are values embedded to it. So the designers and the developers' values matters a lot. So if the developers and the designers are biased in a certain way, let's say how a lot of technologies has been developed by white young people trying to get girls, right? Like, some social media technologies that we know. So these values matter in the way that they are shaping technologies. And this is the same with public health technology. So it matters what your values are. So for AI for Gov, for example, we are led with community development values. So I'm part of the leadership at AI for Gov. So that's embedded. And a lot of us are volunteers in communities. So that's why we are young innovators, because we bring in these values when we're designing, when we're programming. It's not just a matter of a transactional product. And this is where the paradigm shift is what we offer, this paradigm shift, because it's not just about a product being functional, but there's a difference between presence and depth. That's why a lot of applications, after a while, sometimes it is used because of compliance. There will be a big memo saying that, hey, all of you, use this. And
or
of
money.
course,
There's money that goes
yes,
with it, right?
and there's a memorandum asking everybody to use it. Of course, you will have the reach. But after that memorandum has subsided, who else would use this product because they didn't like it? Let's say for a young innovator's perspective, why is this so clunky? And these are perspectives that are not taken into consideration, but user experience matters. The design matters. It's not just a matter of there's input and there's output, there's data, we can have insights. The experience of using this matters a lot because it's psychological as well.
Okay, so I think we're saying, okay, yes to faster, yes to fairer, right? Yes to inclusive,
Yes.
inclusive development and use. All right, so let's talk about what do we need to get there? So we're saying 2040 could be like this, you know, and but it looks like there are challenges, and there are also things that could enable faster, fairer, inclusive, and what should I say, ownership, right? So Maxine, what do you think? Enablers and challenges.
So I think, you know, as Leo's mentioned, it's very important to have the users involved and also to think about the unintended consequences. One of the things I'm seeing is while there's been a proliferation of apps for community-based health workers and volunteers to use, we've actually pushed the cost of delivering services to those volunteers or the least paid, if paid at all, members of the health system.
Yeah.
And so that's not equitable for them. They're not able to maintain those costs all the time. The second thing to think about is that whole sustainability of the whole system. So using it makes it more likely to be cost effective. The more we use it, the more cost effective it's going to be. But we also know that World Bank's estimated we'll need about 4 to 5% of total health expenditure to sustain these systems. And we know at the moment about 52% of the systems being used in low and middle income settings are actually dependent upon donors and development partners. And we also know that only about 25% of those systems are being sustained and maintained. So we also have to start thinking about how are we going to actually sustain these systems when we've proven that they're going to make a difference. We still need a health system to invest in those, or a government, not just the health system, but the government. Because also maybe we were talking earlier, you know, other sectors can use this data. We've already seen how many sectors use data that's come out of disaster and health work to actually then plan other services after a disaster. So that intersectoral use of some of these technologies or infrastructures or ideas about what works could also be integrated, if you like, a one digital health that can actually meet the needs of more than just people's health, but maybe also their social well-being.
Yeah, that's very interesting. I think, you know, you speak about 4 to 6% of health expenditures going into digital health. But then again, this is not a space that health ministries know how to use money for, right? So to kind of look at that amount of money, look at the systems, look at how you procure things, and then you're also in environments where people want to make a fast buck, right, for government money that goes into it. So I'm just, you know, responding a little bit to what we know in the past could come as issues when we say, all right, put more money into this, right? Anyway, Raj, what are your thinkings on enablers and challenges?
So one of the greatest challenges is getting the data, and the other big challenge is feedbacking to the people who give the data. So getting the data, if we engage our nurses and other frontline workers to spend a lot of time on inputting data, which as Priya mentioned, nobody's maybe using it
Yeah.
as planned. That's taking away a lot of time from patient care. So we have new technologies coming in called Internet of Things, where, like for example, we have rapid molecular tests for TB,
Yeah.
which are put at near point of care. But we insisted to the developers of those rapid molecular tests that you need to connect it with the national database. So people don't have to sit down and report to put data into the system, because then it takes away the nursing time, for example.
Absolutely.
So that's one. Sending data should be automated. The machine should be connected to the national database, not people inputting data. The other is, even when the data goes to the national level, as Priya mentioned, if nobody is using it or does not have the time to use those huge or large data sets, then that is a failure. And that's why we need to have automated feedback systems where the digital technology or smart digital technologies can feed back to the frontliners in real time. And then of course there must be some experts who give some feedback over and above that, but this thing should happen automated. Last one thing is that I agree with Lee that we need to address the universal question of what is in it for me. Unless the users of these systems understand how it benefits them, then even they may not be motivated to send input data and send as much as we want. So we have to address that question too. What is it for them?
Yeah,
But
Lee.
there's, can
Yeah,
I
go
just,
ahead,
yeah, no, I was
Maxine,
just
go
going to
ahead.
say, there's other data too, because it's, I mean, personal devices are part of this whole digital health thing. And so this data that comes from it doesn't come from my smartwatch because I don't have one, but the data that comes from smartwatches, is there someone there who can help me interpret what it means? I remember listening to somebody talking about how, because nobody was at the other end of a person who was being home monitored, they watched him pass away over a couple of days as he kept deteriorating in his health. He was with a chronic respiratory problem, but there was nobody at the other end to intervene. Many of the outputs that come from digital devices are not what health workers have been trained to read. A lot of the ECG, the heart, that they're not read easily by providers. So there's also some of those things, other health data that we need to think about.
Yeah, okay. Priya, how about you? What do you think?
Scene made earlier about
Enablers and challenges.
Yeah, so I think I wanted to pick up on the point that Maxine made earlier about sustainability. And that's really a critical issue in settings like Papua New Guinea, where digital health systems and applications are first introduced with high donor support, external support. And so the question then becomes, how then do you transition the system at some point in the future to the government? And these are actually questions that are being discussed right now in Papua New Guinea. And so this is where strengthening that enabling environment, I think, is critical. So that's a key enabler, having the right policies in place, ensuring your health workers, your communities have digital health literacy skills, putting into place the infrastructure, the necessary policies and governance. I think those are really critical enablers to ensuring that we translate digital applications and systems into improvements. And in fact, this webinar comes at a really timely time, because tomorrow we will be discussing the draft digital health strategy in Papua New Guinea, which touches upon a lot of issues that we've been discussing.
Thank you, Priya. Lee, enablers and challenges.
Yeah, I want to build on what Priya mentioned about how does it become sustainable. And one of the examples that worked for us, especially in the beginning, was when we started, when COVID, the crisis happened. So we are a group of young innovators. So immediately what we did was our leadership initiative, which is not to wait for anybody to ask us what to do, but to do it because we are motivated to do it, to help. So then we've done our research, we did our algorithm, and overnight we created a prototype. And we showed it to the Department of Health, and they provided, the leadership provided a space for us to be part. And imagine, that one was, we were just two young people with a little bit of initiative, but we had the working prototype while the rest of the big tech and others had an idea, and we can participate, but let's talk about it. In that case, we did not wait. There was already that. You do not have to pay for us because we're volunteers. So that I wanted to point that out, that first, leadership needs to be intentional in carving a little bit of space for innovators, for young participants to participate, because over time, you would diversify that. And then what happened? After the whole COVID crisis, a lot of people volunteered, right? And this is true across all of the countries. But up to now, 5 years later, we are still there. We are still supporting. Nobody's funding us continuously, but why are we there? Why did the model work? Why is it still sustainable? Because the values, our values as social technological innovators remained. The fire did not stop from there. And that's one of the points that from there, we partnered with a lot of organizations, with other multilaterals who supported the initiative. And whenever there's no funding, we become volunteers. So in a way, if you give that space for young innovators, and we are not unique, there are so many of us, but not everyone gets an opportunity. So if that is part of the strategic agenda, imagine the leverage, the energy of young people that you can leverage in bridging that gap until the next big funding or the next big support comes in. So you're diversifying, a lot of win-win. You're diversifying, you're nurturing the next generation of players, and you are always leveraging the energy, the intrinsic motivation of young people to bridge these divides that they
That's
see.
very inspiring. I think we're talking about the future, we're talking about technology, which young people tend to embrace. We're going to go to a very quick question. I'm going to give you like a minute to think about it. But if you had $10 billion tomorrow to do something really radical, to change the face of digital technology as it's used in the healthcare system, what are the 3 things you're going to spend your $10 billion on? So I'm giving you a tick-tock, 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 right? Okay. We're going to ask Priya first. Priya, $10 billion for the Western Pacific region to do something radical on digital health, digital technology. 3 things that you would do.
You didn't give me a minute, Susie. No, I'm kidding.
No, you're using it now. You're getting it now. Okay, go.
Yeah, so I would invest in skills, people skills. So building capacity of health workers, improving digital health literacy in broader communities, those within departments of health, ministries of health. I would invest in research and development. So what we've discussed before, looking into evaluating digital health systems, researching the operational research, are these working? And the knowledge sharing. So we're doing the research, but we also need to share what's working, what's not, so that other settings can learn from the experience and hopefully improve their digital transformation journey. And the third one would be infrastructure. So getting in places like Papua New Guinea, where we still see that households in rural areas have less than 15%, less than 15% of households have access to the internet, then we really need to be investing in the infrastructure. And I think things like Starlink, which was mentioned before, or other exciting initiatives that are coming up can help with boosting internet coverage, with getting the necessary infrastructure out into those hard-to-reach areas. So I think in that minute you've given me, the 3 things that came up are those. Thank you.
Thank you so much, Priya. Lei,
Okay,
you want small amounts of money. What if somebody gave you $10 billion?
So definitely I'll be true to what I've been advocating, which is participation. So the number one thing that I would do is I will ask the leadership to what are the top 10 priorities, and what are the the priorities will have to be something with a lot of impact, and then I will organize a lot of young innovators to tackle these challenges in a portfolio way. Because if you have a portfolio, 1 out of 10, there will always be something that would work, and then I will give them funding to go ahead and implement. We're not gonna talk about it and then we're gonna die talking about these things until any decision is made. You're gonna go out there, be agile, try all of these things. Here are 1 million each. Try it.
Wow.
Something will work. Something will always work. Like an investment portfolio, right? Something will always work, and then we will have an implementation strategy to adopt these things, but not shake the whole thing. You're gonna carve a sandbox of something that would then implement these things of what works, and then because innovation is iterative, it's not a waterfall. You need to see the long-term evolution of these technologies, because it will find its market fit. It will find its roots, its rooting, and you need to give it time to root as well, without sacrificing the time of, let's have a cerebral conversation about this thing. You just go and implement it. And then the next one is something that two-pronged, is communities. So involving communities, involving their voices. And this is something that is so very close to heart. Involving all of these little expressions. If you're a mother in a geographically isolated, displaced area, what are your expressions that are true to you about cancer, about health, about tuberculosis, about these things that you've experienced? Because you can leverage a technology today like AI for text analysis, and imagine all of these voices. You have a pool of a lot of these things, and now you can quantify it for public policy, and now you can see where the areas are that you can support, and it's true to the realities of the people and not by a few who is sitting on top. So that would be.
Okay, Maxine, 10 billion.
So the first thing is 10 billion, I'd want to know why it's only there for digital health investments. Because we don't get that sort of money for health system investment or for reaching unreached populations.
Yeah.
So I'd then talk to whoever the investor is to see if we can actually try to all have wins. So can we invest in digital health to free up space in health systems to maybe provide the services for those who won't necessarily be reached through digital means? Can we use some of the innovation, a grand challenge perhaps, to find some solutions that may be able to reach some of those harder to reach populations? Or do we subsidise some of their access for the homeless, for refugees, for women who don't have access to resources themselves? So can we actually use it to help bridge that gap? Many people call that digital health inequity and health inequities as a gap. Can we use it to bridge it so that the health system and the digital health, to enable some of that, make the best use of all of the resources, not just 10 billion for digital health, but for it to be effective, we need those other investments to be made as well.
Thank you. Raj.
Assuming that this 10 billion is 5% of the whole health budget to address Maxine's concern, I think I would invest more in self-care and community care, especially for people who cannot reach services easily. And we know that we have huge sections of the society for that. But of course, as Maxine mentioned, this will not address all concerns of the people, and there are some aspects of health which require face-to-face interactions with healthcare providers. But this digital technology would help in triaging. There are some conditions that can be managed digitally through telecare, telemedicine. The other thing is precision medicine, as I mentioned, but not just precision medicine, but also precision everything, precision public health, precision climate resilience. We should be able to predict where the problems are and how to address them in real time. And then the last one is, as I again mentioned earlier, we need to demolish barriers. We need to share infrastructure. We need to have open source collaborations of softwares to make things more affordable by countries that can't afford or people who can't afford.
Okay, thank you so much. Okay, We are coming to our Q&A section, and so I'm going to throw some questions out and just give us a brief reply. So this one, I think I'll give it to Maxine. It's from Suzanne. How can regulations keep pace with the rapid advancement in digital health technologies?
Yeah, I think that's a really important question because many of us who work in health are not necessarily aware of all of the intricacies of what is going to happen in the digital space. And we're already seeing that at a whole of government level in most countries, even high-income countries, that things come out of the blue that they hadn't anticipated. So I think the regulation area needs a sharing of what people are developing at governance levels to try to play that role. Maybe that's something that WHO could actually also help support, best evidence about regulation, guidelines about that. But also we have to bring other sectors in because this isn't health people's core business. They need to talk to people who actually know this stuff. Lawyers, ethicists, developers, a lot of other people who can help us anticipate what's happened. Social media we all saw as a great promise, but now we're talking about all of the concerns with it as well. We need to anticipate that stuff now and not wait till it happens and we have more inequities and injustices occurring.
Yeah, thank you, Maxine. I'm going to give this to Raj. When we use AI for diagnosis, what controls do we need to have in place to ensure that AI-powered tools like X-ray or ultrasound adapt appropriately to all populations with different ethnicity and demographics?
That's a very good question because sometimes when we use the initial data to train the AI, it may be on populations that don't represent the other populations. So that's why even from the development stage, the data that should feed into the AI to train it should be from different ethnicities, different populations, not just from, as I think Lei mentioned, white males from some developed countries.
Yeah. Okay, I'm going to give this to Priya from Sunju. To use digital technology to reach the unreached, identifying the unreached, who can be benefiting from the digital health? Who should come first? How can we identify unreached effectively under low resource settings? Can AI or new technologies for health information play a role? So I think there's the question of reaching the unreached and identifying the unreached. Which one is the most important for AI? Priya, you're mute.
Okay, thank you, Susie, for that question. So would you mind repeating what was asked?
Okay. To use digital technology to reach the unreached or to identify the unreached, which one should come first in low resource settings?
Yeah, so I think it should be, I mean, that's a really good question. And I think it's really dependent on the context. But I think identifying the unreached is really important because you want to know where these populations are who cannot access services, who have health outcomes which are not as good as other populations. And so I think identifying where these populations are critical. And then that can help you to determine, once you better understand these populations, help to determine what are the most appropriate digital health tools to be using. How can AI be best leveraged to meet the needs of these populations? So in summary, I guess I'm saying, I think from my perspective is identifying and understanding these populations is important before then you identify what solution can help you to address their needs.
Yeah, thank you, Priya. Maxine.
The thing is, though, as we say in the regional framework for reaching the unreached, it's not necessarily a static thing. Being unreached can be quite dynamic. It may be geographic location, and again, digital tools could help you with that. It may be looking at who's covered by, say, immunisation and who's not, and try to look at economic and education literacy levels. But it could also be people who have now just lost jobs and they weren't unreached, but now they can't afford to have health services. It may be refugees, people who work in the informal sector who aren't actually being measured and don't want to be measured. So I think we need to also understand that becoming unreached or being unreached can actually change over time. Disasters, we all saw that with COVID. All of a sudden, populations we thought were being reached, we found they weren't, but also some came to the surface. So I think it can help in identifying it, but you have to realise that there are populations who maybe aren't measurable using those sort of quantitative tools, and we need actually investment in people power to actually work with those populations and find out who they are, rather than just relying upon digital tools to do so.
I want
Yeah,
to add,
go ahead, Lee.
I want to add on this, because another hybrid approach in using digital technology is using it through like snowball effects of a digital technology. For example, one of the things that we do is we assume that not everyone has cell phones or has access to Messenger, because the primary thing that we do is Messenger. Why? Because people are already there. So basically you're just redesigning something that is already there versus adopting them to, okay, download this new thing. Right? So that's one of the things. Where are they and how do you reach them? And then the other one is snowball effects. So usually, especially in the Philippine setting, it's relationship-based, right? So one person is going to be connected with other people, their grandparents, their titas in the sitios and the barrios. You only need to reach, for example, the young person with digital technology that she uses for school. But within that one messenger, you can actually, through snowball effects, you can understand what is also happening with the rest of the family that is not connected. So when you use AI technologies in this way, hybrid approaches, you have to be creative. And I go back again to who is designing. Do they have these perspectives?
Yeah, I remember there was some point in time in the past I was working on teenage pregnancy, and there were some researchers who wanted to do a survey in the community, right? And to find a profile. And actually what the community said was, oh, teenage pregnancy, we know where that is. We know where the girls are. And it's the place where there's no electricity. So it's like there is local knowledge there that can be used, right? And if you have AI to support that further, then you can track and help these girls. Okay, we're running out of time, but Raj wants to say something.
Just to add to what Maxine mentioned, whenever we use the term unreached, it seems to imply a geographical dimension or physical dimension. But like Maxine rightly said, there may be people who are unseen, unheard, undocumented. So all these uns are important when we use digital technology, because some of these people may be just in the same room or same community as we live.
They could be here.
Exactly.
Isn't it? Right, okay. So we have to wrap up, but we're going to ask each of our wonderful guests today to give a parting statement. What's your, they call it the SOCO, right? The single overarching communication objective, or your message for our audience on digital health. We're going to start with Priya. Priya, go. She's going to say it's unfair. You're always not giving me enough time. Go, Priya, you got this.
No, that's so digital health, I think, is inevitable now. It's no more the question of should I be adopting it? It's about how I should be adopting it. So I guess my SOCO is lots of potential, exciting, can lead to health system improvements for people and families, but it's about how you're going to do it, ensuring it's done in a sustainable way, ensuring that the benefits are spread equitably.
Thank you. Lei.
Leaders, give your young innovators a space to thrive.
Wonderful. Okay, Raj.
So as you mentioned in the opening sentences, future is here. We need to embrace the digital technology that is already available and keep up with the new things that are developing, and not leave it to just the younger generation like me. So it's for my generation, all generations.
You felt alluded to. Okay.
Because as our DPM Susi already mentioned, AI will not replace humans. Humans who know AI will replace humans who don't.
Yeah, Maxine, you've got the last words on this as the
Thank you
head
very
of the
much.
tag of RTU. Go
So
ahead.
from a community perspective, we need to mind that gap. We need to, if we're planning to use digital health, think about digital health inequities. We need to keep asking, so who's still not being reached and why? And we need to remember that digital health can help us with UHC, but only if we are designing it to reach people with quality, timely, respectful, accessible and acceptable care.
Thank you very much. And that brings to a close our session on digital health. I'd like to thank everyone who joined us, and I'd like to thank all our guests. Stay with us. Be with us next time on your next episode of Your Health Today and Tomorrow, which actually starts now. Our next webinar is on climate-ready and responsive health systems, and then pandemic prevention, preparedness, and response. Don't miss it. Thank you very much, everyone, and have a wonderful day.